My name's Karl Davis. I'm a consultant physician and the clinical lead for 1,000 Lives Falls campaign. This year, Falls Awareness Week is held on the 17th to the 21st of June and its theme is foot care. Falls are common. They affect people of all ages, but by the age of 65, 1 in 3 people fall each year, and by the age of 80, that rises to 1 in 2. Whilst many falls do not cause injury, as we age, the risk of harm increases. There are many things that can be done to reduce the risk of falls and of falls-related injuries. Assessments for someone who has fallen include looking for new medical conditions or acute illnesses, such as infection. Although for the majority of people who have fallen, the falls are related to long-term conditions and frailty. There are many factors that contribute to falls. Poor balance, muscle weakness and certain medications, along with memory problems, trips and home hazards, vision or hearing problems and continence are amongst the recognised risk factors that increase the chance of falling. Falls interventions can reduce falls rates, in some cases prevent falls happening altogether. Reducing hazards, reviewing medications and maintaining muscle strength by regular exercise are all effective in reducing falls. A sometimes overlooked factor relates to foot care and footwear. The importance of good foot care shouldn't be forgotten. There are many foot problems that adversely affect the quality of life and can sometimes contribute directly to falls. Bunions or arthritis are common problems, and even something as simple as overgrown toenails can make walking difficult. If you can't look after your own feet, it's important to have someone look after them for you. There are some groups of older people for whom foot care is particularly important. I recall speaking with one older man who suffered with diabetes and had several falls. Looking at his feet, I was worried about thickened areas on his soles of his feet that were darkened and ulcerated. When I looked at his shoes, it became clear because of his diabetes he'd been unable to feel that the soles of the shoes had worn completely away. Comfortable, well-fitted shoes help reduce the risk of falls. For most people, a shoe should have sides that support the ankle and a firm sole with a good grip, and they should have no more than a small heel. For most older people at risk of falls, the most important footwear is that which is worn around the home. If you're seeing someone about falling, it's important to have looked at the shoes that they wear most of the time. For example, when working in the emergency department, I was asked to see an older lady who was known poor balance and coordination difficulties and who had had many falls. I was asked to see if there was anything more that could be done to reduce her risk of falls. But when she went to walk, she put on her preferred shoes. They were a set of open-toed sandals held simply by a single strap across the forefoot with a 2-inch heel. Many people, and older people particularly, fall each year. Not all see a health professional about their falls. However, there are lots of possible causes for falls and things that can be done to reduce the risk, not only the risk of falling, but also the risk of injury. If you have fallen or know an older person who has, please think about what can be done to reduce the risk of their future falls. And this week, this Falls Week, think particularly about feet and falls. Footwear should fit and be comfortable, and slippers should never be slippy nor sloppy. Thank you.